This introductory learning package provides guidance on the professional responsibility of practitioners in respect of information relating to the patient. It is worthwhile to remember the ethical principle of autonomy when discussing the points suggested in this package. Physicians in all disciplines associated with the administration of healthcare must be very mindful that any information given during a consultation between a patient and healthcare professional must remain confidential. This is a fundamental principle of medical ethics and is central to the trust a patient puts in any healthcare professional. As a healthcare professional, of course you understand the importance of confidentiality. But what exactly is the information that must remain confidential? Information regarding a patient's mental illness or other serious illness must remain between the patient and the practitioner. But what about more general information regarding the patient? For example, what if a healthcare professional receives a call from a friend, family member, or employer of the patient simply asking if the patient had made an appointment? Is the healthcare professional allowed to disclose this information? The answer is no. This is because it is not just what is said during the consultation, but also when the patient accesses the clinic or health service and other general information surrounding the patient. So how do we keep information confidential? Yes, we don't tell people a patient's name, address, or other identifying features, but we must also be very careful about describing a patient we saw in the hospital while walking home with a colleague, for example, and we're telling them about this particular woman who lives quite close to the hospital who came to see somebody about a certain condition. In small towns and cities, it is possible that a bystander might hear this and understand exactly who the two healthcare professionals are talking about, even if the patient's name, age, address, or date of birth is not being mentioned. Sometimes a medical practitioner has to ask other people for information about a patient, and this information that is received from third parties must remain confidential in the same way as information taken in direct conversation with the patient is confidential. There is also a difficulty that practitioners are sometimes faced with when a friend or relative of the patient comes to see the practitioner and wants to know the results of a test or investigation, for example. They may also suggest, in the case of a relative such as a son or daughter, or a father or mother, that it is best to talk to them because the patient in question is too ill or frail to take the burden of the diagnosis. We must be careful that this very caring approach must not override the principle of confidentiality. Practitioners are not allowed to disclose information to a third party, however close they are to the patient or however friendly they are to the patient, until they get consent from the patient. Consent cannot be assumed in any situation. For more information on consent, you can take a look at one of our other videos that deals with this topic. The patient is sometimes very happy to disclose information to friends and relatives, but as a healthcare professional, you must record how that consent was requested and how it was given. So remember, you must not disclose information to anyone without a patient's consent. Sometimes there are circumstances where you have to disclose that information by law. This information can be ordered by a judge in a court of law or by a tribunal or a body established by an act of the government. Sometimes information has to be disclosed because it is mandated by infectious disease regulation. In these circumstances, it is the practitioner's responsibility to inform the patient of the disclosure and the reasons for it. Another situation involving the disclosure of patient information without their consent may be justifiable in exceptional circumstances, when it is necessary to protect the patient or others from serious risk of death or harm. However, you should attempt to obtain consent from the patient for this disclosure. The practitioner has to make a judgment as to whether disclosure of information is justifiable. You should carefully consider whether anonymization of the information would achieve the same potential benefits, and be careful to disclose the information to an appropriate person or body who understands that the information must be kept confidential. Patients should be informed of this disclosure unless it is thought that it would cause them serious harm. Disclosure can sometimes be required in the public's interest, again, only in exceptional circumstances where there may be risks in place. It is generally understood that in healthcare there is a requirement for disclosure of information to other colleagues and health professionals, and most people understand and accept that there is a sharing of information within the healthcare team. Again, it is reasonable to take steps to ensure that when disclosing information to an appropriate person, they understand the information must be kept confidential, and you must let the patient know that this transfer of information has taken place. Sometimes patient information is necessary for quality assurance, but this information should be anonymized as much as possible. Another situation where there is a transfer of information is during education and training. This, of course, is essential to the provision of safe and effective healthcare. During training or educational sessions, the person disclosing the information must ensure that those being taught understand their responsibility to keep the information confidential. Particularly the disclosure of information, photographs or videos on what you learned on social media platforms, as this information could easily be used to identify someone. This, in the past, has in fact resulted in problems for students and could lead to disciplinary action.